Neck pain can be very debilitating. We're glad that you found our office. Let's show you how we are going to correct your neck pain. So, after having completed your paperwork in our comfortable reception area, and then you bring it back to our wonderful receptionist, she is going to guide you back for your exam, x-ray consultation. So come on back here and I'll show you what we do. So we have a lot of different therapies in here that we're going to talk about in just a moment, but we begin with a detailed history and consultation. Because if you're going to get to the root cause of a problem, you have to know what it's about. So your neck pain doesn't just happen to show up. There's always clues. It always leaves clues. So from a postural examination that we'll do using a computer-based program, which is very detailed, we figure out, are you too forward? Is your posture too back? Are you leaning off to a side or a different side? So we're going to figure that out. Now we also do some range of motion examinations. So we determine, based on how you're moving, what is stuck? Is there one joint? Are there 3 joints? Are there 7 joints? We look to see what is the underlying cause. Now, we will also do orthopedic exams. So we look to see how's the joint stressed? Is there a disc issue? And some of the exams that we do help us kind of figure out exactly what the underlying cause is. We'll push down from the side, we'll push down on the other side, lift up on the head, a couple of different exams that we do to figure out exactly what's causing your issues. After that, we do x-rays because we want to see with great detail how your spine is misaligned. So we do an x-ray specifically for neck pain. There's an angle that we need to shoot from the front. Have to. If we don't get that angle, we don't figure out what's wrong with you. We do one from the side. And for your neck pain, very often we'll do what's called a motion study, where we have the extension and we have the flexion, and with great detail we know exactly how the joints are misaligned, because you have 7 neck bones and a skull bone that is a very big player with neck pain often. But those 7 neck bones, every single one should have its range of motion. And if it doesn't, then your body's going to end up suffering because of that. And eventually the symptom shows up. So that is the end of the first visit. At this time, your doctor will go over all the findings. I'll go over all of your x-rays and I'll figure out what do you need to get better, to correct your neck pain, to get to the root cause. So on your second visit, that's when you get your first treatment. So this is our favorite day because we love giving people their first adjustments. The very first and main treatment that we utilize in this office is the chiropractic adjustment. So Dr. 𝐭𝐡𝐚𝐭 is going to demonstrate an arthrostim adjustment. So you can see how it's very, very easy on the spine, very gentle. And he'll also demonstrate what's called a prone cervical adjustment. So it's also very gentle, it's easy. And there's other ways that we can, thank you very much. Now, Julia, we're going to demonstrate how to help the adjustment hold for a longer period of time. So there's different ways that we can treat the patient, and this laser is using one of them. We're going to do something called cervical upregulation. We're going to send more energy through a nerve root to the muscles, and that's going to help her hold her neck muscles in place. Muscles are the primary stabilizers of a joint, so if you can get your neck stronger, you can heal more quickly. Here's how we do it. Arms up and out. Good, stay strong. Do that. And the biceps are fed by C6, triceps are fed by C7, so we wake up all these different nerve roots. C8, palms down, fingers spread out, T1. So that wakes up all the spinal nerve roots in the neck, and then we get to laser them, and more energy goes through those nerve roots to whatever's on the end of that nerve root. Like what? Like your neck muscles. So it's very good for helping your body heal more quickly. So that's another therapy that we use on a regular basis. Let's show you some more things that are potential therapies that you may receive. If your symptoms are being caused by a disc bulge or herniation, this is the table for you. Spinal decompression therapy. It's a very, very good therapy. It helps heal those discs more quickly. This is called shockwave therapy. Shockwave therapy is not electrical. It's an acoustic sound wave that goes deep into your neck muscles and your upper back muscles. And that helps free up those stuck joints that are keeping you from moving properly. When those joints are so stuck and so tight for so long, they're painful. This frees them up, increases the slide and glide, and it feels wonderful. We have two Shockwave units because they're such a popular therapy. Steve is demonstrating the FX405. The very first market clearance that this company got was for chronic neck and shoulder pain. This is the laser. This is the best laser in the world for what our purposes are. With this laser, and he's doing all these range of motion exercises, which is so great for him. It increases energy production, it decreases inflammation. It's a rapid healer. Feels good too. Now, the last therapy is going to be pulsed electromagnetic field therapy, PEMF. It sends an electromagnetic signal through the tissue, draws oxygen and nutrients deeper down into the tissue, and it feels really good. There's different ways that we can apply it. The butterfly is a very common way, and sometimes we double it up, put it on the upper back, sometimes it's in the mid back. She's sitting on a mat right here, which also puts that electromagnetic field out. There's a lot of different ways that we can apply it to the spine. It all depends on what you need. Everybody is unique, and we treat you as the individual that you are. So we appreciate you. We look forward to helping you with your neck pain. Give us a ring.